If you're turning 65, you've probably been buried in Medicare mail, and it feels impossibly complicated. Take a breath, because Medicare really comes down to just a few simple pieces, and by the end of this video you'll understand all of them. I'm going to explain Medicare in plain English, the 4 parts and what each one does, what it actually costs in 2026, the one big choice everyone has to make, and, most important of all, exactly when you need to sign up, because miss that window and you can get a penalty that follows you for the rest of your life. Let's make this simple. Quick and important, I'm not an insurance agent, a financial advisor, or an attorney, and this is education, not advice. The 2026 numbers I'll give change every year, so always confirm the current figures and your own situation at medicare.gov or by calling 1-800-MEDICARE. Medicare has 4 parts, and the easiest way to remember them is by what they cover. Part A is hospital insurance. Think inpatient hospital stays, skilled nursing, hospice. The May, you can think A for admitted. Part B is medical insurance. Doctor visits, outpatient care, tests, preventive services. B for the basics you use all the time. Part C is Medicare Advantage, that's a private all-in-one alternative that bundles A, B, and usually D together. More on that in a minute. Part D is prescription drug coverage, your medications. That's the whole alphabet. A, hospital. B, doctor. C, the all-in-one private option. D, drugs. Everything else is just details on top of these 4. Parts A and B together are called Original Medicare, the traditional government program. Here's the good news on Part A, for most people it's premium-free, because you paid into it through payroll taxes over your working life, generally about 10 years of work. If you didn't work enough, there is a premium, but most people don't pay one for Part A. Part B does have a premium. In 2026, the standard Part B premium is about $202.90 a month, with an annual deductible around $283. Higher earners can pay more through a surcharge called IRMA, but the standard amount is what most people pay. So for most retirees, Part A, free. Part B, around $200 a month. That's your Original Medicare foundation. Now the one decision everyone turning 65 has to make. Once you have Original Medicare, you go one of 2 directions. Path 1, Original Medicare plus a Medigap policy. Original Medicare doesn't cover everything, it leaves gaps, copays, and no yearly out-of-pocket limit. A Medigap plan, sold by private companies, fills those gaps so your costs are predictable. You keep any doctor that takes Medicare, and you usually add a separate Part D drug plan. Path 2, Medicare Advantage, which is Part C. This is an all-in-one private plan that replaces Original Medicare. It often includes drug coverage and extras like dental or vision, sometimes with a low or zero premium. The trade-off, you're usually limited to the plan's network of doctors, and you pay copays as you go. Neither is better for everyone. Medigap means more predictable costs and freedom to choose doctors, Advantage means lower upfront cost and extra perks but a network. This is the choice worth slowing down on, and one where a licensed, independent agent can help you compare for free. Part D covers your prescriptions. If you go the Original Medicare route, you add a stand-alone Part D plan. If you choose Medicare Advantage, it's usually built in. Here's the part people skip and regret. Even if you take no medications today, you generally should still enroll in some drug coverage when you're first eligible, because if you wait, there's a late penalty added to your drug premium, and it lasts as long as you have Part D. Which brings us to the most important thing in this whole video. This is the section to write down. When you turn 65, you get a one-time window called your Initial Enrollment Period. It lasts 7 months, the 3 months before the month you turn 65, your birthday month, and the 3 months after. Sign up in those first 3 months, and your coverage starts the month you turn 65, smooth. Wait until later in the window, and your coverage start gets pushed back. Now the warning. If you miss your window and you don't have other qualifying coverage, like an active employer plan, you can get a late enrollment penalty. For Part B, it's 10% added to your premium for every full year you were late, and you pay it for as long as you have Medicare. Not once. For life. Delay 7 years and your Part B premium is 70% higher, permanently. There's one big exception: if you're still working at 65 with real employer health coverage, you may be able to delay without penalty and sign up later during a special period. But you have to know that applies to you, don't assume. When in doubt, call Medicare before your 65th birthday. 3 quick mistakes to avoid. 1. Missing your enrollment window and eating a lifelong penalty. Mark the 3 months before your 65th birthday on your calendar right now. 2. Skipping drug coverage because you don't take anything and getting penalized later. Get a basic Part D plan when you're first eligible. 3. Picking Advantage or Medigap based on a TV ad instead of your own doctors and medications. Check that your doctors and prescriptions are covered before you enroll. So here's your simple plan. 3 steps. Step 1. 3 months before you turn 65, start your enrollment, don't wait for the birthday. Step 2. Decide your path: original Medicare plus Medigap and a Part D plan, or Medicare Advantage. Compare based on your doctors, your medications, and your budget. Step 3. If you're still working with employer coverage, call 1-800-MEDICARE to confirm whether you can safely delay before your window closes. Medicare feels huge, but it's really just for parts and one deadline. Get those right and the rest falls into place. If this finally made Medicare make sense, hit subscribe. I break down retirement and Medicare decisions in plain English every week, no hype. And tell me in the comments, are you turning 65 soon, or helping someone who is? Next time, Medicare costs in 2026, exactly what you'll pay, line by line, and how to keep it as low as possible. I'm Ray. Take care of your health, and take care of each other.